Good afternoon, Carl Springs, and welcome to our weekly Facebook question and answer. I have the pleasure of being joined here today by our mayor and also by our medical director. We have a lot of initiatives and a lot of updates to provide you with today, so I'm sure we're ready to get right into it. Before we start, please remember that if you have any questions or comments, you can post them in the comments field, and city staff will be happy to answer those questions and get a reply back to you. So to start off with a bit of good news, Mayor, would you mind sharing some information about our food distribution that we have tomorrow morning?
Absolutely. Happy to start off on this positive note. You know, it's very important for everybody to keep their spirits up despite the difficulty of the time. Tomorrow at 9 a.m. For any of our residents that need food, we'll be holding another food drive over at this Coral Square Mall. Last week, we were able to feed over 800 families, and the week before, a little over 700 families. So we're happy to be doing this on a regular basis and utilizing our employees to volunteer in the mornings to help get our residents fed. And every Tuesday at 9 a.m. for the indefinite future, we'll be doing that.
Thank you, Mr. Mayor. We're really trying to do everything we can here in the city to help our residents. And that's just one of our initiatives. Would you mind also giving us a little bit of an overview on the Give Where You Live program?
Sure. We recently revamped this idea through the community chest of Coral Springs. It started many years ago, and this is where we were asking our residents to give where you live. It's to help our residents that are in need and our small businesses that are in need. And if you have the financial ability to give back through this campaign, we would appreciate that support. You can go to our Coral Springs Community Chest website.
Excellent information. I know we've done a lot already to try to help our residents and our businesses. Can you share a little bit more? Is there anything else that we're doing in terms of help for the business community?
Absolutely. Our economic development team have been doing an excellent job with sharing resources and information directly to our local businesses. We have a hotline. We've served over dozens of businesses, and that's 954-344-5772. And our local business owners can receive information, get some wisdom about how to deal with their business during this tough time, and help them make a transition based on what orders are coming down to us from both the governor's office and from the county's office.
Thank you. I appreciate that, Mr. Mayor. You know, our Economic Development Office is truly doing a remarkable job. I'd like us to move on to some health updates and start to ask some questions of Dr. Antevi. In Florida, we've conducted just over 350,000 tests. Of those 350,000, just over 32,000 were positive. As of 10 a.m. yesterday, we were looking at about 4,700 tests positive here in Broward County and 182 tests here in Coral Springs. It's important to note that we don't have recovery numbers for those yet, so we're going to watch those cases continue to climb. And while those cases do continue to climb, we do know that people are recovering from this virus. Those numbers are important because, as Dr. Antevi is going to explain to us, those are going to actually outline our efforts and help us with our decision making as we start to move towards a reopening plan. So Dr. Antevi, Miami-Dade County conducted a test which indicated that a large number of residents had the virus and didn't know it. What was this test that was conducted? What was accurate? And are we going to be doing something similar here in Broward County? And Dr. Antevi, I think you're muted. As we conduct these Facebook Lives socially distant, we continue to jump over our hurdles.
Yes, Alex. Good afternoon, everyone. Mr. Mayor, thanks for coming on today. It's great to see you again. Alex, thanks for coordinating this as usual. The testing, as everyone's heard on the news, I think is a very important topic. It's not such an easy topic. The tests you're hearing about at Miami-Dade, those are the single drop blood tests, very similar to a blood sugar test or a pregnancy test. Those tests are good in the right hands, meaning that you have to know what test you're using and have validated that test. And we're in the process of validating some tests here in Coral Springs. We've been doing that for a couple of weeks with some good results. But then you also have to have the ability to know what to do with that test once you have a result. And so it's not so easy to just take the test and then look at the result and then know what to do next. You should probably have an algorithm that's been developed by the city, in my opinion, and we're working on that now, so that the test doesn't just be, is not really given to someone and given the wrong answer as what to do next. So I think word to the wise, tread very lightly, understand the data behind these tests, and then have the right medical team behind it to allow cities to open properly, businesses, and even people to understand where they stand particularly.
And as a follow-up to that, in today's press conference, Governor DeSantis mentioned that pharmacies were going to be issuing COVID-19 testing. Are these pharmacies going to be the new normal? Are we going to move away from those drive-up and walk-up testing sites?
You know, I have an opinion on that, in that our pharmacists are great people and they do some great work for us. But remember, they are not used to actually administering tests. In my experience over the last month, administering lots of these tests myself, and I've been a physician, an ER doc for 20 years. You know, I can tell you that the way that these tests are built, you really have to have some knowledge of how to actually draw the blood and use a small pipette to actually use the test. So number one, I think there is some training that goes into that. Number two, you have to be able to give the advice to the person who you just gave the test to, and be collecting the data for your specific city. So I have no problem with doctors' offices giving the test, urgent care clinics, and so forth, but it happened by someone who then knows what to do with the result. And so I would say, let's see how that goes. But I would say that the city, perhaps, and I know we're doing this, should be setting up maybe a broader goal for the rest, for our residents.
I appreciate that insight, Doctor, and we are certainly working towards getting better testing throughout the county. So we'll continue to work with our partners on that. Another bit of information that we've been getting back is that folks have been avoiding medical treatment for heart attacks, strokes, and other serious conditions. Can you please outline for our residents just how important it is for them to get critical care and how important it is for them to seek care if they need it?
Yes, you know, Alex, this topic has come up, and you're exactly right. It was reported by Cynthia Goodman in the Sun Sentinel the other day. We've seen it in the emergency department, a significant reduction in people coming in for things like chest pain, stroke. And then on the other hand, on the EMS side, we're arriving to homes finding that people are a lot sicker and they're waiting a lot longer. I can tell you that at Coral Springs, we started piloting a telehealth process where myself or Chief Cardona, we can actually telehealth in with the person before I'm on scene. What I've noticed myself is that people are expressing to me how fearful they are of going to the hospital. So it's true that that's happening, but I will say that a lot of people are putting themselves at risk by not going to the hospital. So I would say do the right thing. If you're sick and you're not feeling well, don't wait. Waiting another 5 minutes, 10 minutes, an hour may cause you to risk your own life. And so I really want to urge everyone to do the right thing when it comes to getting the appropriate medical care. And of course, you should call your doctor to get guidance on that.
Thank you, Dr. Antevi. Very important information. And I'd like to reiterate to our folks at home that, you know, if you need care, please seek that out. And the best way to avoid catching COVID-19 is through those personal hygiene efforts that we've been discussing all along: proper hand washing, social distancing, and staying home if you don't need to go out. Mayor Brook mentioned that soon enough we're going to be transitioning into our recovery. We're going to be working towards reopening, and we're going to be working towards assisting our business community. Over the weekend, we've heard a lot about what Miami-Dade County is planning to do. We're continuing to work with Broward County, and we will have updated information for you as soon as that becomes available. You can stay tuned to all of the up-to-date information here in the city by going to our website, www.carlsprings.org. You can also call our community call center at 954-344-1001. And you could also text the keyword Carl Springs to the number 888-777. Those are all information sources that will provide you with up-to-date details and will provide you with localized information about how it affects us here in the city of Coral Springs. So before we sign off for the evening, I'd like to turn it over to you, Mayor, if you have any closing remarks for our residents.
I really appreciate that. Yeah, I just want to add a little bit more about what economic development is doing and what we're attempting to do for and with our businesses. We're working with our CRA board, we're working with our city attorney to find other grants that might be available for the small business owners here and connecting them with connecting businesses to loans and grant program. And we'll also be helping businesses by, engaging with them in very safe and very methodical reopening efforts in the near future. So I just ask everybody, stay vigilant about your safety and our community's safety, and stay hopeful. So thank you very much for allowing me to join you here today.
Thank you, Mr. Mayor, and thank you, Dr. Antevi. This is going to conclude our question and answer for today. Remember, stay safe and stay home.